Welcome to Moving to Portugal Daily, episode 38. I'm Mateos Costa. Today, we dive into health and insurance dossier, how to use Portuguese healthcare and smart private insurance to strengthen your residency case, and at the same time, boost your energy, appearance, and anti-aging routine, with practical steps to help you relocate smarter and live better in Portugal. Hook. Most listeners think the residency story is built only from bank transfers and a lease. But here's something many nomads miss. A GP card, a private policy with clean invoices, and a dentist receipt can speak much louder to CEF and Finanças about your real life here. If you're nervous about renewals, or you feel lonely trying to prove you've made Portugal your home, this angle changes the game, quietly, legally, and in a way that also improves how you look and feel every day. Promise and roadmap. In the next 9 minutes, I'll give you a tight 3-step health and insurance dossier you can start today. We'll cover the Portuguese healthcare landscape and what official authorities typically accept as medical evidence, a step-by-step way to register with local medicine and capture the right receipts and notes, a simple anti-aging and energy protocol that doubles as repeatable evidence, a real nomad example, and a 1-week action plan you can execute immediately.
Portuguese healthcare landscape. In practical terms, Portugal has a public system, the SNS, and a wide private network of clinics and doctors. For residency proof, you don't need to become a medical expert. You need documented, regular interaction with the local health system. CEF and Finanças typically accept itemized invoices, clinical appointment notes, prescriptions, or referral letters that include your name, date, clinic details, and ideally, your NIF or passport number. The quality of documentation matters. Generic, anonymous receipts rarely carry weight. Clear, itemized, dated documents do. Remember, rules can vary by case and office, so treat this as a tactical, complementary layer to your banking and housing evidence, not the sole pillar of your application.
Step 1. Local medical ties. Register and document. First, verify the exact SNS eligibility steps for your status. This can include presenting your passport and residence paperwork at a local health center. Once you have access, choose a family doctor or a local GP, in Portuguese, a médico de família or médico de clínica, and register with that center. If public registration is slow or not yet available, a private GP is a perfectly fine starting point. Schedule 3 baseline visits in your first month: a general practitioner check, a dental cleaning or exam, and an optician or basic dermatology consult. At each visit, ask the clinic to provide an itemized invoice and a short clinical note or receipt that includes your full name, date, the clinic name, service descriptions, and ideally your NIF or passport. These items become repeatable, dated evidence of local healthcare engagement. Keep digital copies and a single organized folder named Health and Insurance Dossier with PDFs and scans.
Step 2. Private insurance and receipts. Pick visa-friendly plans. Not all private health policies are created equal for residency evidence. Look for plans that issue clear, itemized invoices with a policy number and insurer contact information. Avoid one-off travel cover that gives a single generic receipt. Instead, choose an annual private health plan or a clinic membership that generates repeated documentation. Use an insurance broker if the policy wording is confusing. Brokers can confirm the invoice formats and that policy numbers will appear on billing. Maintain a clean audit trail. Pay premiums with traceable bank transfers or card payments, keep monthly or annual statements, and save all invoices in your dossier. Those repeated payments plus itemized medical receipts tell a consistent story of life in Portugal. Step 3. Anti-aging and energy protocol that doubles as proof. Design simple, repeatable clinic routines. Start with a baseline blood panel, vitamin D, B12, thyroid function, basic metabolic panel, and lipids. Then schedule a follow-up in 6 months. Book a dental hygiene visit and a short dermatology skin check. These are services that create legitimate, dated interactions and objective records. From a personal optimization standpoint, consistent blood work and a dermatologist's assessment accelerate anti-aging efforts. You'll more confidently manage skin health, inflammation, and energy with measurable data. Keep the clinical notes concise. A line about the reason for visit and findings is enough. Use supplements responsibly and under clinician guidance. Think of this as a medically supervised lifestyle plan that also strengthens your dossier.
Real Nomad example and common mistakes. A recent D7 renewal case I saw involved a client who had steady bank statements but an uncertain housing history. What turned the renewal in their favor was a consistent set of GP notes, 3 dental invoices across the year, and private insurance invoices showing regular payments and itemized clinic bills. SEF valued the pattern of local medical care. Common mistakes to avoid: accepting anonymous cash receipts without clinic details, waiting until the renewal window to book your first appointments, or buying a cheap travel policy that produces one vague receipt. Mitigations: always ask for itemized invoices, plan regular check-ins, and use a broker or the course checklist to confirm invoice formats.
Immediate action step. 5 things to do this week. 1. Register with a local GP or a private clinic and capture the registration confirmation. 2. Purchase an annual private health plan that issues itemized invoices with a policy number. 3. Book and attend 3 baseline visits: GP, dentist, and optician or dermatologist. 4. Order a basic blood panel and save the lab report as a PDF. 5. Create a single encrypted folder, physical or cloud, called Health and Insurance Dossier, and save every invoice and clinical note there. These 5 actions will generate the kinds of repeatable, dated evidence authorities look for, and you'll also start improving your energy and appearance in a measurable way.
Course CTA. If you want the exact templates I use with clients, the folder structure, invoice checklist, email scripts to request the right clinic notes, and an insurance comparison table, grab the Health and Insurance Dossier templates inside Nomad Life Success. The template walks you through how to request SEF useful notes, which invoice fields to verify, and how to store documents securely while protecting your medical privacy. Use the templates to avoid common pitfalls and to build a clean, convincing dossier faster.
Final confidence-building sign-off. Portugal rewards preparation. Start with 1 baseline visit and 1 invoice-friendly insurance policy this week. Portugal isn't just a destination. It's your optimized new beginning. That's your daily Portugal blueprint. Start applying one thing this week.